We are going to demonstrate the application of the Bird&Cronin Quick Wrap Universal Knee Immobilizer. Knee immobilizers are frequently used for the treatment of knee fractures, sprains, dislocations, and are also used after knee surgery. Begin by choosing the correct length knee immobilizer. It is critical to determine the proper length of the immobilizer prior to the actual application. A correctly sized immobilizer fits on the leg 2 inches to 3 inches above the lateral malleolus and 6 inches to 8 inches below the femoral head or 2 inches below the groin. Open the knee immobilizer and remove the medial and lateral stays. Position the immobilizer on the leg so that posterior or rear stays are positioned properly. Secure the immobilizer with the 2 temporary tabs to hold it in place while applying. Position the pressure-sensitive medial stay along the center of the leg. Position the pressure-sensitive lateral stay along the center of the leg. Wrap the alternating elastic straps over the medial and lateral stays and attach to the body of the knee immobilizer. For the best positioning, start with the straps closest to the knee. It is a good idea to go back and tighten the straps to make sure the immobilizer is securely positioned on the leg. Please note the number of straps vary depending on the length of the immobilizer. This completes the application of the Bird&Cronin Quick Wrap Universal Knee Immobilizer.